Good day everyone. Today we will be discussing about the drug named valproic acid. Valproic acid comes under the pharmacological category of anticonvulsants. Valproic acid is a medication with diverse mechanisms of action that are not yet fully comprehended. Some of the suggested mechanisms of action for VPA include 1. Inhibition of voltage-gated sodium channels. Valproic acid obstructs the entry of sodium ions into neurons, leading to decreased neuron excitability and firing rate. This prevents the generation and propagation of abnormal electrical impulses responsible for triggering seizures. Inhibition of gamma-aminobutyric acid transaminase. Valproic acid inhibits the function of the GABA transaminase enzyme, which is responsible for degrading GABA, the predominant inhibitory neurotransmitter in the brain. This process increases the levels and activity of GABA, thereby enhancing the inhibition of neuronal function and ultimately diminishing the vulnerability to seizures. In cases of neuropathic pain, valproic acid has been demonstrated to impede neurogenic inflammation through GABA-A receptor-mediated inhibition. Enhancement of GABA synthesis. Valproic acid stimulates the synthesis of GABA by increasing the expression and activity of glutamic acid decarboxylase, the enzyme responsible for converting glutamate, which is the primary excitatory neurotransmitter in the brain, into GABA. This process also contributes to the increase in GABA levels and activity. GABA is synthesized from alpha-ketoglutarate via the tricarboxylic acid cycle and metabolized into succinate semialdehyde. This intermediate is further transformed into succinate by GABA transaminase and succinate semialdehyde dehydrogenase, respectively. Prior research has indicated that valproic acid inhibits GABA transaminase and succinate semialdehyde dehydrogenase, thereby elevating GABA concentration by reducing its degradation. Inhibition of HDAC. Valproic acid inhibits the action of HDAC enzymes, notably HDAC1, which are involved in the regulation of gene expression by modifying the acetylation status of histones, which are proteins that wrap around DNA. This process leads to changes in chromatin structure, subsequently influencing the transcription of many genes, including those linked to neuronal plasticity, synaptic transmission, neurogenesis, neuroprotection, and inflammation. This phenomenon could potentially elucidate a portion of the enduring effects of valproic acid on mood, cognition, neurodevelopment, apoptosis, and its potential anti-tumor properties. Modulation of calcium channels. Valproic acid modulates the activity of various calcium channels, including T-type, L-type, and N-type calcium channels. These channels are essential in neuronal signaling, neurotransmitter release, gene expression, and cellular survival. The exact effects of valproic acid on calcium channels are complex and depend on several factors, such as channel subtype, location, state, and co-expression with other proteins. Certain studies indicate that valproic acid effectively inhibits T-type calcium channels, which have been implicated in absence seizures and thalamocortical oscillations. Other studies suggest that valproic acid enhances L-type calcium channels, which are involved in neuronal plasticity and neuroprotection. Valproic acid also affects N-type calcium channels associated with neuropathic pain and migraine. Valproic acid holds FDA-approved indications for a diverse range of neurological and psychiatric conditions. It is used as a monotherapy and adjunctive therapy to address complex partial seizures in adult and pediatric patients aged 10 and older. It is used as a standalone and adjunctive therapy to treat both simple and complex absence seizures in adults and pediatric patients. It is also used as an adjunctive therapy for patients with multiple seizure types, encompassing absence seizures. Beyond its FDA-approved indications, valproic acid also finds utility in several off-label applications, as listed below. Manic episodes associated with bipolar disorder. Migraine prophylaxis. Emergency treatment of status epilepticus. Diabetic peripheral neuropathy. Postherpetic neuralgia. Impulsivity, agitation, and aggression. The common adverse effects of valproic acid include gastrointestinal, neurological, and hematological symptoms. These adverse effects usually occur at the beginning of valproic acid treatment or after dosage modifications. However, these adverse effects usually diminish or resolve over time or with appropriate dosage adjustments. The adverse effects associated with the medication include headache, abdominal pain, somnolence, dizziness, thrombocytopenia, asthenia, nausea and vomiting, diarrhea, tremor, weight changes, alopecia, constipation, emotional lability, insomnia, petechiae and ecchymosis, depression, rash, nervousness, appetite changes, alanine transaminase and aspartate aminotransferase elevation, tinnitus, blurred vision, nystagmus, photosensitivity, myalgia, and dyspnea. Valproic acid can lead to several severe adverse reactions, including hepatotoxicity, hallucinations, suicidality, psychosis, toxic epidermal necrolysis, Stevens-Johnson syndrome, anaphylaxis, hyponatremia, SIAD, pancreatitis, thrombocytopenia, pancytopenia, hyperammonemia, myelosuppression, hypothermia, aplastic anemia, bleeding, erythema multiforme, polycystic ovarian syndrome, cerebral pseudoatrophy, encephalopathy, and coma. Although these adverse effects are infrequent, they can potentially be life-threatening. Therefore, immediate medical intervention and discontinuation of valproic acid are imperative in such cases. The abrupt discontinuation of the drug can trigger withdrawal seizures. Valproic acid interacts with an array of drugs, some of which can be beneficial and enhance the therapeutic effect of valproic acid or reduce its adverse effects. Conversely, certain interactions can be detrimental, potentially diminishing the therapeutic efficacy of valproic acid or increasing its adverse effects. Some interactions are bidirectional, impacting both valproic acid and the concurrently administered medication. Valproic acid interactions can be categorized into pharmacokinetic or pharmacodynamic interactions, further divided into enzyme-based or transporter-based interactions. Enzyme-inducing drug interactions. Valproic acid is a weak inhibitor of various cytochrome P450 enzymes, including CYP2C9 and CYP2C19. Co-administration of drugs that induce these enzymes, such as carbamazepine, phenytoin, and rifampin, can increase the metabolism of valproic acid. This may result in decreased plasma concentration levels and potentially compromise the efficacy of the medication. Dosage adjustments or alternative treatment options may be necessary in these cases. Enzyme-inhibiting drug interactions. Valproic acid is primarily metabolized via the glucuronidation pathway, mediated by UGT enzymes. Drugs that inhibit UGT enzymes, such as aspirin, felbamate, and some NSAIDs, can interfere with glucuronidation, leading to increased plasma concentrations of valproic acid. In such scenarios, monitoring valproic acid levels closely and considering potential dosage adjustments in patients is advisable. Protein-binding interactions. Valproic acid exhibits substantial binding to proteins, predominantly to albumin. When valproic acid is administered concurrently with other highly protein-bound medications, such as salicylates and sulfonamides, the potential exists for competition over albumin-binding sites. This could potentially elevate the free fraction of valproic acid and increase the risk of adverse effects of the drug. In such cases, monitoring for signs of valproic acid toxicity and adjusting the dosages as needed is advisable. Valproic acid can interact with other antiepileptic drugs, including lamotrigine and phenobarbital. This can result in modifications to plasma concentrations, potentially impacting both efficacy and toxicity. In such situations, monitoring drug levels and adjusting the dosages as needed is advisable. Valproic acid is contraindicated in patients with significant hepatic impairment, hypersensitivity to components of the drug or its class, urea cycle disorders, mitochondrial disorders, suspected disorders in patients younger than 2, and during pregnancy, especially for migraine prophylaxis with valproic acid. LFTs should be monitored at baseline and then at regular intervals, particularly within the first 6 months of valproic acid treatment or if hereditary mitochondrial disease is present. Complete blood count with differential, coagulation tests, and ammonia levels should be assessed at baseline, periodically, before planned surgical procedures, and throughout pregnancy. Thank you. Kindly comment for further queries and doubts.